Welcome back to my channel, your go-to source for mastering the medical concepts. Today, we are diving into one of the most critical cardiovascular conditions, atherosclerosis. So, we will see some MCQs with detailed explanations to not only help you pass your exams but truly understand the condition. So, let's get started. First question, which of the following is the initial step in the development of atherosclerosis? So the options are smooth muscle proliferation, thrombus formation, endothelial injury, and lipid accumulation in the media. So the answer is endothelial injury because atherosclerosis begins with the damage to the inner lining of the blood vessel, which is known as the endothelium. So here it gets damaged, which increases the permeability, and it also triggers the inflammation, which sets the stage for the plaque formation. Second question, which of the following lipoproteins is most strongly associated with the development of the atherosclerosis? So the options are HDL, VLDL, LDL, and chylomicrons. So the correct answer is LDL. Why? Because LDL are also known as the low density lipoproteins. They carry the cholesterol to the tissues. Here, when they are oxidized, they are taken up by the macrophages, and this contributes to the plaque formation. Third question, foam cells in the atherosclerotic plaques are derived from. So the options are platelets, fibroblasts, macrophages, and endothelial cells. So the correct answer is macrophages. Why? Because the monocytes, they migrate to the intima, which become the macrophages, and they engulf the oxidized LDL to become the foam cells, which is the key component of the fatty streaks. Fourth question, which of the following is considered protective against the atherosclerosis? So the options are high LDL, high triglycerides, high HDL, and elevated homocysteine. So the answer will be high HDL. Why? Because HDL is the high density lipoprotein. It is also known as the good cholesterol. So it helps to remove the cholesterol from the bloodstream and the arterial walls, which transport it to the liver for the excretion. Fifth question, a complication of atherosclerosis that directly leads to the myocardial infarction is? So the options are vasospasm, arterial dissection, aneurysm rupture, and the fourth option is thrombus formation on a ruptured plaque. So the answer will be thrombus formation on a ruptured plaque. Why? Because when an atherosclerotic plaque ruptures, it exposes the subendothelial components that promote the clot formation, which leads to the vessel occlusion and the myocardial infarction. Sixth question, which of the following is a non-modifiable risk factor for atherosclerosis? So the options are smoking, family history, diabetes mellitus, and hyperlipidemia. So the answer will be family history. Why? Because other factors like smoking, hyperlipidemia, they can be controlled or treated, and diabetes mellitus, it can also be controlled. Seventh question, what is the role of the smooth muscle cell in the progression of the atherosclerotic plaques? So the options are, first, they prevent the plaque formation. Second, they secrete the antibodies against LDL. Third, they migrate to the intima and secrete the extracellular matrix. Fourth, they phagocytize the lipids. So the answer will be they migrate to the intima and secrete the extracellular matrix. Why? Because the smooth muscle cells, they migrate from the media to the intima where they proliferate, and here they also secrete collagen and the matrix proteins, which contribute to the plaque stability and the growth. Eighth question, atherosclerosis most commonly affects which type of the artery? Options are veins, elastic arteries, arterioles, and capillaries. So the answer is elastic arteries. Why? Because the atherosclerosis primarily affects the large and the medium-sized elastics in the muscular arteries such as the aorta, coronary and carotid arteries due to high pressure flow and the turbulence. Ninth question. Inflammatory marker which is associated with the atherosclerosis is options are ESR, CRP, interleukin 2 and TNF alpha. So the answer is CRP. It is the C-reactive protein which is the high sensitive CRP. It is a marker of a systemic inflammation and is associated with the increased risk of the cardiovascular events and the progression of the atherosclerosis. 10th question. A vulnerable plaque is characterized by the options are first, thin fibrous cap with large lipid core, second, small lipid core, third, thick calcified cells, fourth, large fibrous cap. So the answer is thin fibrous cap with the large lipid core. Why? Because the vulnerable plaques are more prone to rupture and from the thrombosis. So they have a thin fibrous cap, a large lipid-rich core, and are infiltrated with the inflammatory cells like macrophages. Thanks for watching. Don't forget to like, share, and subscribe for more medical MCQs and conceptual videos.